With a GFR of 20 or less, you have now reached advanced CKD stage 4 and are vastly approaching the need for a kidney transplant or dialysis. You might be thinking, why would I want a kidney transplant? Once most people get a kidney transplant, they will no longer have to get dialysis, or possibly even have to start dialysis in the first place. Usually, most people will start feeling much better with an increase in energy, less fluid gains, and less dietary restrictions. Many people are able to return to work rather than spend their days in a dialysis center. For a kidney transplant, there are 2 options available should you qualify. In order to qualify, you'll need to be evaluated by a transplant center. The first type of kidney transplant is with a kidney from a living person. Someone living can donate one of their kidneys to you. This is known as a living donor. Most people are born with 2 kidneys, and being we only need 1 kidney to live, a living donor would donate one of the kidneys to you by sharing their spare. This is the best and quickest option, which takes at least 3 months, but could take a lot longer with the workup that is needed prior to the transplant. The second option is to get a cadaver kidney. A cadaver kidney is a kidney from a recently deceased person that chose to donate their organs to those in need before they passed away. The wait for a cadaver kidney is the biggest hurdle, since it could take up to 5 years for this to happen, and often patients go on dialysis while waiting for a cadaver kidney to become available for them to get a kidney transplant. Here's the process of getting a kidney transplant. Your nephrologist will refer you to a transplant center to be evaluated. At this point, you can request which transplant center you prefer, should you have a preference. You'll receive a call from the transplant program and be scheduled for an appointment. At your appointment for the transplant evaluation, you'll be evaluated to determine if you're a good candidate for a kidney transplant. This evaluation process will take several weeks to months to be considered for a kidney transplant. A number of tests will be performed, which will check your heart, lungs, and other organs. The goal here is to make sure you can tolerate the surgery and not die. Once the workup is completed, you'll be placed on the active list if you're deemed a good candidate and do not have a person that can donate their kidney to you. Once placed on the waiting list for a cadaver kidney, the average waiting time is between 3 to 5 years for a cadaver kidney, depending on where you live, your blood type, antibodies in your blood, and if you're currently on dialysis.